For adults who live an active lifestyle, participating or competing in sports can sometimes come with the added risk of getting injured. I know that very well. This morning on Ask a Specialist, we'll talk about some common injuries with Dr. Will van der Reis, Orthopedic Surgery and Sports Medicine at the Queens Medical Center, West Oahu. Good morning, doctor. How are you doing this morning?
Good morning. I'm doing well. Thank you very much.
Now, first off, what is sports medicine and what type of injuries do you treat?
So it's a discipline within medicine where we treat injuries that occur during an athletic-related event. We treat simple injuries like joint sprains and muscle strains, and we can often treat more complicated injuries like the cardiac event that happened with Damar Hamlin of the Buffalo Bills. These injuries occur in young kids, weekend warriors, and even professional athletes.
And doctor, how do you treat these sports injuries?
We use what's called a team-based approach, meaning we have a wide range of providers. That includes physical therapists, chiropractors, primary care doctors that treat sports-related injuries, and then surgical specialists like myself. Initially, we start with a non-surgical program that includes modifying your activities, heating, icing, medications, and physical therapy. And if those modalities fail, then we consider surgical intervention. And what we like to do these days is use what's called minimally invasive or arthroscopic techniques, where we use small, tiny holes rather than the traditional larger incisions that are used with surgery. And what we found is there's really three keys to a good surgical outcome. One is having a patient that's motivated to get better. Two is having a really good physical therapist help guide their rehab program. And three is using those minimally invasive surgical techniques that I just mentioned.
And finally, doctor, have you seen any COVID-related effects on sports injuries?
Interestingly, we did. What happened was as soon as everybody was released to get back to play sports, particularly kids, there was a big spike in muscle strains and ligament sprains. And the reason was everybody assumed they could get back to their previous level of activity without really taking the time and care to rehab properly. The good news is most of those injuries resolved with non-surgical treatment, activity modification, and proper rehab. But the lesson we learned is that after events like COVID or after extended time off with an injury, you really do need to take time to build back to normal and not ignore those pains that don't go away, particularly in the older athletes, the weekend warriors. And if you do have pain that doesn't go away, make sure to either go to an urgent care, see your primary care doctor, or see a sports medicine specialist like myself.
Now, to learn more about injury prevention and treatment, you can join Dr. van der Reis for the Queen's free virtual Speaking of Health lecture. That's coming up this Thursday, January 19th from noon to 1 p.m. You can sign up. Just visit www.queens.org/events, or you can just give them a call at 808-691-7117. Thank you very much, Dr. van der Reis, for your time, and have a great day.
Have a wonderful day. Thank you for your time.